Hi there, welcome to Bariatric Boss Bish. I'm Tara, and today we're going to talk about the different types of bariatric surgery and which one may be right for you. Like I said in my last episode, diet and exercise doesn't always work for everyone. So turning to bariatric surgery is a great way for you to get your weight under control and gain the tools that you need in order to be successful in your weight loss journey. So let's get into the different types of bariatric surgery, starting from least popular to most popular, and then we'll talk about revisions at the end. The least popular surgery today is the band, also known as the Lapband. Back in 2011, this made up 36% of all bariatric surgeries in the United States. Today, it barely makes up 1%. The band is a small adjustable ring that is surgically inserted around the upper portion of the stomach, creating a small pouch about 1 ounce in capacity and has a 1-inch opening down to the rest of the stomach. The advantages of this technique is short-term weight loss and no part of your body is being removed. The cons of this is that when they insert this, they leave a little inlet under the skin where the surgeon can inflate or deflate the restriction on the stomach. It can be tricky getting it right. It requires regular monitoring and adjustments and can cause scar tissue and slipping of the stomach. The point of this surgery is to help you feel full faster, or what surgeons call restriction. It is performed laparoscopically and has been pretty much eliminated from a lot of bariatric surgeons' menus. One of the things that you'll find as we look at the demographics later on is that the band was so popular in 2011, and as that started to go down, the sleeve gained popularity. We'll get to the sleeve in a little bit. Next is the duodenal switch. This is where the first portion of the small intestine is just divided just past the outlet of the stomach. A portion of the small intestine, the last portion, so the last quarter of the small intestine, is then brought up to be connected to the outlet of the new created stomach, so that when the patient eats, the food goes right through to a newly created tubular stomach pouch and empties directly into the last segment of the small intestine. Again, 3/4 of the small intestine is then bypassed by food. So the bypassed small intestine will then carry the bile and pancreatic enzymes that are necessary for the breakdown of absorption of protein and fats. It's reconnected to the last portion of the small intestine so they can eventually mix with the food stream. The procedure reduces the amount of food that is consumed. However, over time, the effect lessens and the patients are eventually able to consume near normal amounts of food. Unlike any of the other procedures, there is a significant amount of bowel that is bypassed by the food stream. Additionally, the food does not mix with the bile and pancreatic enzymes until far down the small intestine. This results in significant decrease in the absorption of calories and nutrients. One of the issues with this is that you need to take vitamins for the rest of your life. You have to go in for chronic blood monitoring to ensure that you have enough vitamin and mineral absorption. There's also possible gallbladder issues and higher frequency of diarrhea. This is the most invasive surgery as it reroutes your intestines in 2 different ways. And so this also only accounts for 1% of bariatric surgeries in the United States. Next is the gastric balloon. The gastric balloon started gaining popularity in 2016, and up to 2019, it's only made up 2% of bariatric surgeries. The balloon is exactly what it sounds like. The surgeon inserts a balloon into the stomach endoscopically, which means they go down your throat, instead of opening you up laparoscopically through your tummy. So the balloon is then inflated to make you feel full faster, and it restricts the flow of food into your small intestines. So the pros, it's offered to people with a BMI of 35 or under, and it's removable. The cons are that the balloon may actually break down in the stomach from the stomach acid and move into your small intestines and create an obstruction. And it's only recommended to be placed for about 6 months and then removed and replaced, or another bariatric surgery should be considered depending on what your BMI is. Next up is the Roux or gastric bypass surgery. This makes up about 17% of all bariatric surgeries performed in the United States today. Lumped into this number is the mini gastric bypass. Now, there's a lot of talk about mini bypass versus bypass. So let's get into the differences between the mini and the full bypass. So the mini bypass, the stomach is cut in a different way. So it's cut into basically a tube-like structure that is now your new stomach. So then they also reroute where your small intestines attach to your stomach. So this is basically bypassing the larger portion of your stomach and a portion of your small intestines. Now, something that I didn't find in my research is how much small intestine is bypassed. So that's something that you'll have to talk to your doctor about, because I believe each doctor is different. I read somewhere between 2 and 7 feet of small intestines being bypassed, and then somewhere I read 1 and 4 feet. So ask your surgeon what their preference is, and they'll be able to give you more information on that. Now for the bypass. The bypass stomach is cut. Basically, your stomach is a football, the size of a football, so 12 inches by 6 inches. And that is reduced down to a golf ball sized pouch. And this cut, the way they cut the stomach, is a little more tricky than just cutting your stomach into a tube shape. So then, just like the mini bypass, your small intestines are then rerouted as well. And again, talk to your doctor about how far that is. The pros for both of these surgeries is that it reduces your comorbidities like diabetes and acid reflux, especially the regular bypass. The cons are that they're both fairly invasive. The mini is less invasive than the bypass. So here's some interesting facts about the bypass and the mini bypass. So the highest amount of excess weight that you can lose is through the gastric bypass. The least invasive surgery is the mini gastric bypass. The least number of potential side effects is also the mini gastric bypass. The lowest cost of the procedure, basically they're about the same, especially when you go look at prices from Mexico. But if you're looking in the United States, they should be a fairly similar cost. The highest reduction in comorbidities and health-related problems is the gastric bypass. And the most popular surgery is the gastric bypass. And the most effective conversion from failed gastric sleeve is the mini bypass. And a lot of folks who had the Lapband are also opting to go to the mini bypass as well. Last but not least is the sleeve. 60% of all bariatric surgeries are the sleeve as of right now in the United States. So the sleeve is also known as the vertical sleeve gastrectomy, or VSG. This has been the most popular option since 2016 and is now the most popular and least invasive bariatric procedure today outside of the balloon. The sleeve is one internal incision which is closed with 2 to 3 rows of staples. What you're left with on the inside is a stomach that can hold about 3 to 4 ounces of food. It does not reroute your intestines at all, and the stomach functions as normal, just in a much smaller size. Pros to this option: it's the least invasive type of surgery. It is restrictive and so not malabsorptive. So if you have to take a pill that's a long release or an extended release type of pill, the gastric sleeve is potentially a good option for you, because in the bypass or the mini bypass or the duodenal switch, you are not absorbing all of what your medication is giving you. So I highly recommend talking to your surgeon and understanding the risks of each of these surgeries. Now let's talk about revisions. Since 2015, the amount of revisions have been on the rise, partly because of the amount of surgeons who are no longer supporting the Lapband procedure. So as you can see, the Lapband procedure has gone down significantly in percentage of surgeries, and revisions have gone up. So that leads me to believe that a vast number of the people who have the Lapband surgery have been revising that to either the sleeve or the mini bypass. And like I said, people can also revise from the sleeve to a mini bypass, and that's fairly successful if you do in fact stretch your pouch, or if you do have to have a malabsorptive procedure as well. As with any surgery, know your risks, get educated, and understand what is going to happen to your body when you go through the surgery that you have chosen. And please make sure that you are listening to the recommendations of your surgeon and go from there. You need to make the decision of what's best for you and your body. So that concludes this episode. Please let me know about your journey. I want to hear about which surgery you decided, or if you're on the fence, I want to hear about that too. Please like and subscribe and have a great day. Thank you.